Hey everybody, Health Coach Erin here. Hope you're having a great day. Today we're doing some rambling and walking, and I'd like to talk with you about this is kind of part one of two. The subject, we've talked about stress and some ways to kind of mitigate stress and how and why that's important. But I'd like to talk about the signs and symptoms that you may experience if you are having chronic stress. And part two will be more kind of how that actually affects the body, even internally, on levels that we may feel but may not see. So first, I want to give you some of the sources. I read lots of articles and want to make sure that I always have the most kind of up-to-date information. And so some of the sources that I'm using for this conversation today include WebMD, Medical News Today, and the American Institute of Stress. That was actually a discovery I made when I thought about doing this talk, and I hadn't stumbled upon that website yet. So that's really interesting, and I plan on digging in even more on that website soon. Lots of good information there. So as part one today, we're going to talk about the signs and symptoms that you may find with your body and your mind and your emotions if you are experiencing chronic stress. So we know that stress is a normal part of life. We all experience it. We can experience different types of stress and have that coming at us from many different angles, unfortunately. But there's financial stress, there's relational stress. We may have difficult or strained relationships. That can cause us stress. There's also good old-fashioned, work stress and school stress. And the list is just endless, as you probably know. But since we have all of those things coming at us, we may manifest that differently. We may feel that differently from person to person. So I thought I'd just compile kind of a general overview of some of the things that, if you can take any kind of time and self-reflect a little bit, you may notice symptoms are there that we've either learned to ignore or maybe just haven't noticed because we were so involved with other things. So symptoms range from physical, emotional, cognitive, so there's all different types of symptoms. And as you may know, one thing kind of leads to another, and those symptoms can have almost like a domino effect. And so that's why it's really important as we learn to identify those and how of course, to mitigate those before they become a problem. So first, one of the signs that many people experience is difficulty sleeping. And this is a toughie because we've all experienced this at one time or another, and some people have, chronic sleep issues that may or may not be stress related, but lack of sleep itself can really just kind of, it's like throwing gasoline on a fire because our body needs that time to rest and recuperate and rejuvenate. So when we have difficulty sleeping, that kind of leads to a general fatigue or maybe even chronic fatigue, and that can lead to weight gain and frequent illnesses, and our immunities go down. And so it's that chain effect that really can affect us in a negative way. It can also give us that foggy brain, right? When we don't get enough sleep, we're not functioning at our optimal level. And so I have experienced brain fog, some which I can contribute or attribute to some of the chronic things that I deal with, but certainly in times of stress, I just cannot get my thoughts together, and you're lucky if you can understand some of the sentences I try and spew out. So that's certainly one that I experience. Some emotional symptoms of chronic stress may be the feeling of just being overwhelmed, and that doesn't feel good. I certainly don't function properly when I'm feeling that way. we can be easily agitated. I certainly don't enjoy being there either. I wouldn't imagine that most people would. Trouble relaxing. So when we're kind of on that continual heightened alert, our adrenaline's constantly pumping and our body doesn't know what to do with it, we can't relax. And relaxation is a work in progress for many of us anyway. And so those times of chronic stress just make that more difficult for us. Other people may emotionally withdraw. We handle things differently. Like I said, things manifest in each of us a little bit differently. And so you or others that you may know, loved ones, family members, friends, may find themselves kind of retreating from socializing with others or being around other people. Some of the physical symptoms of chronic stress include low energy, headaches. I know, as some of you may know, I have kind of chronic migraines that I deal with. And so while I can help myself largely with exercise and nutrition choices, and that's very helpful during times of stress, many of our chronic issues that we deal with can kind of rear their ugly heads. And it's because our bodies just aren't running at their full capability. And stress affects that. So we need to be aware that we're not going to feel our best when we're experiencing chronic stress. Other kind of physical signs and symptoms of chronic stress, and a very common physical symptom, are stomach issues. So we talk about something called the wisdom of the body. And that basically means that our bodies know what they're supposed to do and how they're supposed to operate optimally. And when we disrupt that with chronic fatigue, chronic stress, unresolved things, boy, they let us know. And so I know so many people, we've heard of nervous stomach. Well, that's part of what this is. There's so many nerve endings in our stomach that Dr. Sears, the physician who created the certification program that I went through, and many other folks in the medical field call the stomach basically the second brain. And so that's because the stomach is the other place that has more nerve endings than any other place other than the brain and the body. So stomach issues are a very common sign of stress, and certainly chronic stress. And they're not very fun symptoms either. I mean, that is certainly something we'd like to try to avoid. Other physical symptoms would be like teeth clenching and grinding, kind of just, I find myself clenching often, and I'm like, all right, relax that jaw. So it's good to be aware. If we can help ourselves out in those moments, that may be helpful and prevent some of that jaw pain or tooth issues or headaches even too. So another physical symptom that I can't avoid is when we experience chronic stress, or sometimes episodes of just high stress, we can have chest pain. And that is one of those that should set off those alarms and whistles. And that is one of those instances where if you're experiencing chest pain, you need to seek medical attention. Many times it doesn't indicate necessarily a heart attack, but other times it can. And it is never, ever, ever something to ignore. So don't question it. Just go get seen, get yourself checked out. So a couple of more signs and symptoms that we may be experiencing chronic stress can be changes in appetite. And that's just changes from our norm. That can mean more appetite, less appetite, but a change in appetite overall can indicate that we're experiencing that. And another sign and symptom can be behavioral changes, nervousness, or just not feeling right. Those are things that we should not ignore. I think another point I iterate is that we learn to ignore a lot, and we learn to just kind of brush things off. And I think that is a detriment to us because again, the wisdom of the body, our bodies are giving us signs and signals that we need to pay attention to. Now, not every one of them, of course, is a life-threatening thing, but they are indicators of things that we could possibly correct with some adjustments or even awareness. Awareness goes a long way. So the last thing that I'll reiterate is, if you are feeling the signs and symptoms of chronic stress, know that first of all, you're not alone. So many of us get to a point where we have so many things coming at us and we've just been trying to process, and we get to a point where we're exhausted, right? We're fatigued. And so it's nothing weird. It's nothing that indicates that you are anything outside of the realm of normal at all. But there may be times that I would encourage you to please seek help. Again, this doesn't mean that we're crazy or any of those terms we like to throw at people. It doesn't mean we're weak. It doesn't mean that we just can't handle things. Again, your health is worth taking the time to make sure that you're doing okay. And there's so many professionals and so many veins of support. And so I just want to reiterate that stress is normal, but when we get into the area of kind of chronic stress and don't know how to handle that, we don't want our bodies to suffer. So this, like I said, this is kind of part 1 of part 2. And so next time we'll talk about the actual effects of stress inside the body and what that chronic stress can do to us. So if you want to know more, please reach out. I'm here to help. And like I said, never underestimate the power of talking to someone if you need to. Chances are people that you know may have been through something similar, and you have friends and family, and reaching out to a professional sometimes is exactly what we need. And it's never a bad thing to get help if and when we need it. So again, thanks. And next time we'll talk about the effects of chronic stress on the body. Have a great day. Thanks, and I'll see you next time.